This morning we're going to be discussing autism. I have a very talented guest with me here today, and Amanda Adams is from the Central California Autism, Central California Autism Center here in Fresno, located on Fresno State. She has a Ph.D. and a B.C.B.A, received her Master's in Arts in Psychology, emphasis on behavior analysis from the University of Nevada, Reno. She has a Ph.D. from Florida State University under the mentorship of John Bailey. She is a board-certified behavioral analyst. Currently, she's an associate professor from Fresno State Department of Psychology, and you would never know it by looking at her because she's so beautiful and young-looking. She's the coordinator in the master's program in applied behavioral analysis and the director of the Central California Autism Center. Thank you so much for coming today. I really appreciate it.
Thank you for
and
having
your time. Here on this program, it's our goal. We're not necessarily reaching out to people who've been dealing with autism for years, but we want to make the community at large more aware of what autism is, the symptoms, and so forth. So those of you that do have children with autism, or you are in the beginning stages of suspecting possibly that your child might have some issues, this would be good for you. So I wanted to start out, Dr. Adams, with regards to, you've published several articles. Are you still working and publishing, spending a lot of time doing that?
Yeah, it's one of the goals of the center is to develop a line of research and continue researching as we go, because things change very fast in this field. Everything's changing quickly, but in treatment for autism specifically, we find new techniques and improvements on techniques, and it's always changing. So I find by doing our own research at the clinic, it helps us stay in touch with the latest that's going around all across the country, all of our colleagues that are doing similar research. And then contributing to that and being a part of the mix, I think helps keep us on the cutting edge of the best possible treatment.
And so then when you in-house, so to speak, have used the new techniques or treatments that you have learned about and have shared, or you yourselves have realized is working, is effective, then you are writing and publishing that in a scientific journal, or is that specifically for, because I know every field has its own publications.
We do some of both. Some writing has been for the general public, but most of it is geared towards peer-reviewed journals within the area of behavior analysis primarily. But there's also some journals that are autism specific that we're working towards with some colleagues.
And are you publishing that? So you said for the general public. So how would they find that? Where is it available?
Some of those are just articles on autism in general that are in local magazines or some book chapters or even websites, those kinds of writings that might go out. And there are not a lot of those, but there's a couple.
Okay. Later on in the programming, we do have some website resources, including your website, which we're going to give to our audience as well. But in doing research, I found that although there is quite a bit of information out there, there's not a ton compared to some other disorders or illnesses. So I found that interesting. What exactly is autism or autism spectrum disorder? Explain to our audience.
Okay. Autism is they consider it a phenomenological diagnosis. So that means that there's no medical test that will prove it or disprove it. So it has to be a qualified diagnostician that will just go through a set of observations, and using some assessments and different diagnostic scales, they'll rate a person on their symptoms. And the symptoms come in three categories: communication, which is mostly in the form of vocal or verbal delay, or odd communication style. And the other is social relatedness, so the ability to relate to people and the environment. And then the third is atypical behaviors, so stereotypical behaviors or self-injurious behaviors that usually all people display, but some people with autism either do way too much or way too little.
Can you give us an example of that?
Yeah, like for children, tantruming is normal. All children tantrum, but sometimes children with autism tantrum to a high excess, just maybe hours at a time, or for things that don't seem typical.
Right, that don't seem really necessary to be throwing a fit about. They
Right.
get upset. Also, environmental, can't they be thrown into a fit of, one would look at it as a tantrum, or also just uncontrollable behavior with environmental influences?
Yes, that's right. Yeah, all people feel comfortable when they're familiar with their surroundings. But so this is again where we get the spectrum idea that it's all people fall along here somewhere. But then people with autism spectrum disorder might feel incredibly uncomfortable when things aren't the same.
Right.
And
they
then
like routine, right?
Yes, and with children, especially children, but it can go a little bit older too. It can really affect their behavior and their demeanor. So sometimes with children to the point of tantrums.
Okay, so excessive tantruming or not being able to behave, quote unquote, in a new environment or around a lot of people. Explain the determination. Okay, well, we went into that. In diagnosis, you really look more at behavior, and then you have some. I have some friends who are psychologists, and they had mentioned once that there's a lot of testing, and I think I walked in, I don't remember why, it was years ago, walked into where they were doing some testing with a young child. And so aren't they doing, explain to me what kind of things they do to figure out.
All right, we have some scales, we always need to ask parents what's going on because they have the entire picture. And a diagnostician, no matter how good they are, still
Just an
only
hour
have a
or 2
snapshot.
hours, yeah.
So lots of questionnaires that parents are going to end up filling out about the big picture of what their child typically acts like. But with the diagnostician, they'll probably do some exercises together. So maybe something that might look like play to see if maybe the child will give eye contact or take turns, or if I ask for the cup of water, if you would hand it to me. So things that typical children probably would respond to and would enjoy doing. And they're testing to see the social relatedness, the ability to respond to a request, the willingness to give eye contact and joint attention. Those kinds of things are what they're looking for in those examinations.
I noticed in several images that I found related to that testing process were little children who had created lines of toys. What's that all about?
Lining things up and some other repetitive kinds of behavior are common with autism and not with any other disorder. So that's kind of a red flag.
Okay, that's one of the red flags.
Yeah,
okay, that we're going to cover.
There are many things that that children with autism do that could be related to other disorders as well, or a speech delay, or an intellectual disability of another kind. But there are certain things about autism that are very specific. And so something like lining objects up or playing with toys in an odd way, like instead of rolling a truck, flipping it over and spinning the wheels of the truck, something like that would be indicative of autism.
That's interesting, that particular thing. Is that like the motion or something that triggers just a different...
The best we can guess, it's attending to a different type of the stimulus. So most children would attend to the rolling of the truck, and the whole object would be what they would relate to. And it seems that kids with autism are relating to the wheel and the spinning of it rather than the entire object and what it's for. So they just focus in a little bit differently.
Yeah, that's interesting. Does early diagnosis, now we talked about, working with children, what can early diagnosis and intervention do to improve their ability to relate to society and work on tasks at hand and that type of thing?
This is a huge,
what you do, right?
huge question, and I always want to couch this answer because the earlier the better. Early intervention makes a world of difference. But this could be a disheartening answer for people who have a child who's already a bit older. So I want to make sure to include the caveat.
Of
Maybe
course.
We'll talk later about older children who can still improve dramatically. So this is not to discourage the treatment of older kids, but early intervention is the most important thing that we can do to make the biggest difference. And there's a couple of reasons for this. One is the idea of neuroplasticity, so the idea that younger brains are more changeable, or they can learn new things more easily.
Right. Better absorb the information and the
we
techniques.
can actually change the neural pathways and the way the neurology constructs. So we have some neuroscience now that backs this up, but we've seen it and observed it for years. So younger children aren't as entrenched in habits. They don't know as much. So if you think about beginning with a 3-year-old, there's only so far they can be behind. So
Right.
if they're a little bit deficit in skills, maybe they're only 2 years behind. Probably not even that, but 1 year to 2 years behind in skills. That's a lot easier to close that gap than if we're talking about a 6 or 7-year-old and they could be 4 or 5 years behind in skills. And closing that gap is much, much more difficult.
Well, and you spoke on the neural pathways, and we covered that in some of our other programs. Isn't it below 5 and under when the brain is developing all those different pathways? So if you're able to catch them at that point. Now, with children who are at a later stage or older, they're coming into you because I would imagine, as in so many different things, and the way that families, if there's a problem of any kind, quite often, and I'm speaking from my own personal experience, we want to ignore it or imagine that it really isn't a big issue, and we kind of poo-poo, everything's fine, they're fine. Is that why you see, what are some of the reasons why people are coming in so much later? I would imagine that was one, but there must be other.
It's better now.
Okay.
Years ago, the diagnostician expertise in our area and in other areas.
Minimal. Huh?
Yeah, was minimal. It's growing now. It's grown a great deal. And also just the public awareness. So just knowing that's something to pay attention to at all. There's a lot of common knowledge and that says, oh, don't worry about that, boys talk later than girls, or, my child did that till they were 6, don't worry about it. And so there's a lot of parents that kind of have their fears either relieved or maybe poo-pooed a little bit, and like, don't worry about that, it'll be fine. And we've had certain cases of even having pediatricians that have told parents, don't worry about this, it'll be fine, they'll go away. And there's so much variability with children. They don't go at the same pace together.
Right.
So it's very believable that a child may just be developing differently. So we don't want to cause panic by saying, if any of these things are hit, it might be autism and you should go seek treatment. But in the worst case, we start intervention, which really amounts to just excellent teaching, and your child doesn't develop autism, and that's fine. So it's better to be on the safe side. Without causing panic, we want people to be conservative about looking at symptoms and possible red flags.
And being aware, really observing. I know this might sound difficult when you're, a parent of multiple children as well. Let's say you have a 2-year-old who's displaying some of those symptoms, and you have little young children. You're really busy running around trying to take care of a lot of stuff, but trying the best to your ability to be aware of how they're playing and how they're interacting with the other kids is really critical. And that poo-pooing, parents, especially new parents, maybe the first kid, they're paranoid about so many things quite often that they doubt themselves so many times. We had a child who had a parasite, and I knew, and this was my 5th child, so I knew something was wrong, and I kept taking her back to the doctor, and the doctors kept poo-pooing until I got a wonderful doctor who hopefully someday will be on my show, Dr. Dirksen, who said, did they test her stool? And as soon as we found that out, we took care of it, but she was literally melting away. Her whole body was in pain, so we won't go into that, but we're going to discuss further autism and take out all the information we can out of you on this topic right after this commercial. We'll be right back.
All right, thank you.
This segment has been brought to you by Horn Photo in the Bellagio at River Park. For all of your photo and camera needs, go to Horn Photo in the Bellagio at River Park.
Family photos tell your stories. Faces, places, milestones, and moments. You probably meant to preserve those memories, but where are those pictures now? Hiding in boxes or inside the discoloring pages of old albums? Do you own hours of home movies and videotapes that you can't even watch? Slides and negatives that you've saved for all these years and you never get to see? Think of all those precious memories that you've saved from the past to share with the future. Thanks to technology, we're taking more photos than ever, but we're not printing them like we should. Those digital images are held hostage on phones, tablets, and hard drives, leaving them as high-risk targets for accidents and hardware failure. What will happen to all of these images that tell your life story? Cherish those captured memories, not by hiding them, but by safely saving them. Put this overwhelming task on your own agenda or enlist Horn Photo's expertise. Horn Photo provides hands-on help from day one with organizing, scanning, restoring, and duplicating photographs. We can digitize your print and video memories onto DVD for easy viewing and safe, efficient storage. All you need to do is gather your prints, slides, negatives, and videos, then bring them into Horn Photo, where we will care for your cherished memories. In most cases, you can pick up your originals and your DVD within a few days. Once everything is on DVD, it's easy and affordable to order copies of your DVD for your children, siblings, and the rest of your family, so that you can share your memories with everyone. The best part is what can happen once your memories are digitized. We will show you how to transform your pictures into keepsake photo gifts and products you can enjoy for years to come. Don't wait for a disaster to destroy your collection of memories. Take steps to sort, save, and share your life in photos, whether you do it yourself or have Horn Photo help. Stop into Horn Photo and see our full range of solutions for saving and sharing your precious memories.
You can advertise your business, your product, or your event on Central Valley Talk, the Valley's only internet television station. Several of our programs are also picked up on Dish and cable networks. For the best advertising dollar, call Central Valley Talk at 579-1360.
CentralValleyTalk.com.
Hi, you're watching CentralValleyTalk.com, and this is Courageous Journeys with me, Theodora Michelides, and today I have Amanda Adams from our I keep goofing this up here, Central California Autism Center. A lot of C's. So we were just discussing autism, and I'd like you to tell our viewers how relevant it is, what the statistics are of how many people actually are diagnosed. And I know it's constantly changing, right?
Yeah, it is a lot. So if you've looked at any news source lately, you've probably seen different numbers. It's been from 1 in 110 all the way to 1 in 77 in the last couple of years. And there's a little bit of explanation for that discrepancy. No matter, even if you take the highest number, 1 in 110, it's still very startling. And so it's continued to come down over the past 10 years, a higher and higher prevalence. And it depends if they're looking at the entire spectrum of autism, which would include P.D.D.
Which I think was what I was looking at, because it was 1 in 88.
Yes, and that's the everybody. And then the larger number, the 1 in 110 or 1 in 120, depending on what source you're looking at, is the most severe or just the autism diagnosis.
Okay. Speak to us a little bit about the whole, because the diagnosis, the terminology just recently changed,
Yes.
right?
The DSM-5 is going to eliminate the different categories and just call it autism spectrum disorder. And the DSM-4 had different categories within ASD.
So why simplifying versus dividing?
Honestly, I've not heard a good reason
Okay.
why we're doing that. I think because it really is, it can present differently. So you have to get a number of symptoms marked in each of 3 categories in order to get the full-blown autism diagnosis. And if you were to just get a few of those categories marked, then you would have the PDD, or pervasive developmental disorder. But sometimes families go to more than one diagnostician and get more than one diagnosis. And so that might have had something to do with changing the criteria.
To make it available for them to seek, I would
Yes.
imagine, for that
It
reason.
does
That would
affect
make
their
sense.
treatment. Yes, it does. So
Okay.
This might help.
And what's the explanation for the continuing increase? Would you narrow that down to just specifically awareness, or are there other conditions that may be causing the increase?
They have really tried to figure that out, and nobody has, to be really honest. Part of it is better diagnostics, and part of it is more awareness. But the state of California did a study, and so did the state of New York, to really try to hone in on what it was. And they could factor out for better diagnosis and better information, but it didn't take care of all of the information. So it seems that there really is a true increase in incidence, and many things are to blame, possibly. A theory is that there are environmental factors, something like air pollutants, perhaps. None of the studies that have suggested environmental contributors are,
Conclusive?
yes.
Well, I had a guest on here quite a few shows back discussing raw milk, and he had a slide which I found really shocking about autism with regards to the, not Quakers, the, oh my gosh.
A certain group.
A certain group that they were so low, but my point is that with regards to the environment, they were growing all their own foods, their produce, they were drinking raw milk.
Interesting.
Amish, yes, thank you, guest out there in the audience. And I said, well, what is that? And they said, unfortunately, there haven't been enough tests to have any conclusive,
yeah.
but it did. The graph showed there was a huge difference in the percentages of the minimal autism showing itself in the Amish community versus outside. So environmental factors as far as what we're putting into our
bodies. There could be lots
bodies.
of other things too. We know, what we do know is that there is also a genetic factor.
There is, okay.
There is a genetic factor, but it's like many other genetic factors. So you might have some heart disease in your family, but that doesn't necessarily mean that you're going to get it. And even if you do carry a gene for it, it doesn't mean it will express necessarily. So it's a very complex interaction. We know that there's likely something environmental that triggers the genetic predisposition to occur, but really piecing together how that works is years of waste.
Is there research going on right now? Is someone doing that type of research?
Yes. Many places across the country. The closest to us is UC Davis. The Mind Institute has incredible research about this, and their website's quite extensive, so you can
Would
look
you
at
give
some
our
of that.
viewers their? I didn't
Certainly.
find that. Their website address. Do you know by heart?
I don't know.
Okay,
But
we
if
can look it
it's
up during
easy
the
to
break.
Google.
Okay.
Yeah.
But that's say it again, the name of
The
it.
UC Davis Mind Institute.
Okay, so if they Google that, they can
It'll
find
pop
it.
right up.
I found a few different resources, but that one I didn't seem to click on and read what they were doing. So
Pretty nitty-gritty neuroscience and other high-level, very broad-scale genetic experiments and things like that they're going to try to piece together things. So
interesting. I'm glad to hear that because, unfortunately, what I'm hearing a lot of is that in psychiatry and mental illness and these disorders, a lot of them are being so underfunded, and research is being so underfunded that we aren't getting the kind of research done that we need to make a
well,
difference.
that's the problem here too. We have the prevalence of autism and the growth of it is more than the next 4 childhood disorders put together. And the funding for it, though, is something like 20th on the list of what's being researched.
Really?
So, yeah, I may not have that figure exactly right, but the prevalence versus the money that's going to research it is completely out of whack.
And here locally, sorry that this wasn't one of the questions, so I don't mean to throw you off, but here locally, are there fundraisers going on or anything to help your center? Or
Yeah, there are several groups working on this. FEAT stands for Families for Effective Autism Treatment, is an active group in town, and they do fundraisers throughout the year. Their biggest is called Cam Twisters. It's an old card show that they do at River Park. We also have an Autism Speaks local group that does a little bit. There's some other groups too that I don't mean to omit, but FEAT has a good resource. And our own, the Central California Autism Center at Fresno State is beginning an ambassador program to involve people in the community who would like to contribute in some way or just be involved, or if their position in the community might bring some attention or resource, then we can include them in that significant way and make sure that they
And
have
do you have
information.
somebody already designated to be the contact person for that?
We do, and you can also reach just through our own website. We can get that information
Okay.
to her.
So I noticed on your website on the contact us, then you do have some of the staff members. I didn't notice that specific designation, but I was focusing on you.
Yeah.
Okay. So yeah, going to the website, and your website is again
It's ccac-fresnostate.org.
.org. Right. Okay. Oh, and we had just spoke on Autism Speaks. Now, how familiar are you with Autism Speaks? Because I know they did have a lot of information that I found helpful on their website, and it was started by a family, right?
That's right. Yeah, grandparents actually. It's a great resource. They have very good information on there. They're very active. they've been able to accomplish more than other groups have in a short period of time.
That's fantastic.
Yeah, so they highly recommend it. It's a very good
And are
tool.
they a nonprofit? So they're
Yes.
raising funds so then
Yes.
somebody can reach out to them. And you said there's a group, which I didn't find, here locally that you can get involved in. I'm glad to hear that for sure. One question that came up, which cannot be conclusive either, at least that's what I read, is the whether or not vaccines play any role. A lot of people are concerned about vaccines for a lot of different things, and they're very important historically to get rid of,
Yes.
right? But then people are also wondering if they're suspect with triggering things. What is your knowledge based on that, or can you tell us about that?
They have done many studies on this. The World Health Organization and the CDC have really looked at this issue. They have not found anything to link vaccines to autism. I know this is a controversial topic, and many families still believe that it may have been the trigger. I don't think that we can necessarily rule out its role, but it certainly is not a causal factor.
Okay.
So we have way too many kids who have received the vaccines and are totally fine to make it any kind of cause. It's possible that some combination of environment and genetics and the timing of the shot may have done some things, but it's not directly because of the vaccines.
Right.
And there's lots of information now that has shown that stopping the vaccinations is more dangerous than
Well,
the
and because a
alternative.
lot of people are choosing to not vaccinate their children, we have a rise. Now we have things coming back
That's
into
right.
society that were stopped for
That's
many
right.
years.
In
So that's
Great
a
Britain,
problem.
They've had smallpox reoccur, and this is not something we want.
We want, no, we do not want an
No.
epidemic of smallpox.
The problem with the shots was an additive called thimerosal, which is a mercury derivative, and they have since removed that. It hasn't been in shots for over a decade now, not in the MMR shot, which is the one
Right.
that they thought was the culprit. And the removal of thimerosal co-occurred with a huge increase in the diagnosis of autism nationwide. So that's one little piece. There's lots of other things, but it really.
But there's
it
nothing
doesn't seem-
conclusive.
no.
So we want to
think it-
dismay that myth.
Yeah, and it may actually pull people off the right course,
Right.
if they go down too long. So that's the main reason, is to really look at what is probably more important.
Okay. Really quickly before we wrap up for a commercial break, let's talk a little bit about the red flags. We touched on it earlier with the toys being lined up, but what are some of the other red flags?
The most important red flags are eye contact and joint attention, or the social relatedness factor. A lot of people want to look at language, and language is certainly a concern. You should be diligent about looking at that, but that could be other disorders as
Right.
well. So eye contact, the lack of a point, and the lack of joint attention. Looking at something and wanting you to join me
Together, to
And-
like
yes.
communicate together
Yes.
about a particular object?
Yes.
Like when you're playing with the
That-
child?
Yes, and the social relatedness, the social aloofness, those are most concerning things with the younger children. Even babies will look and maybe imitate sticking out your tongue or
Right.
making your eyes big, and lack of that kind of imitation and relatedness is very concerning. And also, autism is so it's not the same with everybody.
Right.
So just because one of these things is missing shouldn't throw you off the track.
Right, you have to look at the whole picture, as you
Yes.
mentioned earlier. Well, we have a lot more information to bring to you right after the commercial, so we'll be right back.
This segment is brought to you by Corrine Hatfield of Platinum Mortgage. If you are thinking of purchasing a new home or refinancing an existing home, call Corrine Hatfield at 917-7111.
Watch Tim Thiessen live.